What a pleasure it is to follow two of our nation's great leaders, and it's incredibly gratifying. I feel like we've come to a party. I remember when some of us were sitting around the table saying, you know, it's been a good ride, and there's a lot more to do, but it's in the spirit of celebration that I bring you a few comments. Lila asked me to speak today about something that I've certainly spent a lot of time with, but also care a lot about. And I think the description both of them used of having passion has described a lot of efforts. I'm in danger here, guys. I sort of felt like I was having a great time. I was going back in history. You know, when I started this, my slides were Kodachrome. I wasn't born with a chip in my head, and I had a really good time. I went back, and I felt like I was kind of going back in time and pulling together some memories, great laughs, thoughts, bungles, a little bit of everything, some great runs, some false starts before we got some of this rolling forward. And I'm going to share with you some of that. It'll bring some smiles to some faces in the room that remember some of it. And in contrast to the two predecessors, I think probably the higher up you go, the less you require PowerPoint slides. You're going to see a lot with me. So from my humble spot, let me tell you, I've left some people off the list. I've already thought of a couple. And so I grew up with a couple parents that had been children of the Depression, and family dinners were always a big part of my life and still are. And we always left a seat at the table, and that was because people would show up hungry in my parents' home, and they always wanted to feel like anybody who showed up had a seat at the table. So we do that in my house now. There's a seat at the table in my talk, and that's for the people that I've forgotten. You're welcome. And I'm sorry I forgot you, but I've got colleagues at the table who are going to remind me who I forgot to mention in the next few minutes. So here I go. Enjoy the memories. It's from a high level, but here are my thoughts on medication labels and health literacy. So you'll recall when the report came out, we started meeting for that report. I believe it was 2002, met for a couple years. The report came out in 2004. There's not a specific recommendation in the report to medication labels, but there was a lot going on. We certainly knew there were a lot of pill bottles out there. We knew that there were 10,000, as a matter of fact, prescription drug labels that were around in the US. There were around 2,000, a whole lot of over-the-counter medicines as well. There were over 300,000 OTC products on the market in 2001. And there was thinking about this. We knew in the US we took a whole lot of medicines and that we were taking even more. And there was an astounding amount of the expenditures in the US budget that were going toward prescription drugs. It had actually gone up from 5% in 1980 to by the year 2000. We were spending 10% of US expenditures on prescription labels. And you knew the numbers. I mean, you heard about it. Average American over the age of 65 was taking 6 or 7 medications. They were coming from 8 prescribers. It was confusing, puzzling, if you will, frustrating to patients. And a lot of folks knew that it could probably be better. When I started thinking about this, I thought, God, you know, it's like a puzzle, right? I like that word. You know, it's a noun and a verb, like labels. You know, a noun and a verb. And I started saying, okay, well, what were the pieces of this puzzle? And this is where I may get in trouble, but I hope you'll enjoy the ride. All right, patients. They were clearly a piece of the puzzle, right? And you'll recall that there were over 35 hours of videotapes and interviews. And, you know, we heard a lot through those as we synthesized them and listened to them that people were struggling. And we knew that health literacy was indeed something that was patient-centered. This is a slide of mine. That's not my cell phone. This is a slide of mine that Harvey Feinberg actually borrowed when the report came out. And he liked this slide. And I like it because I had used it when we tried to develop the TOEFL. And we were going to have a question in the TOEFL about picking out a teaspoon, but out of our 200 in the cohort, we couldn't find a single person that could identify which one of these actually held 5 cc's. And Harvey, at the time the report came out, made a comment, there's nothing more patient-centered than health literacy. It starts with a patient, and it ends with the patient. So certainly patients and who they were and what they were thinking about was a central piece of this puzzle. And we knew that there was all this variability in all these labels. I remember thinking, it's been over a decade since I said, you know, if we can get that word twice off every pill bottle, I'm going to retire. Well, I got to tell you, that was then, and then is now I still want to retire if we can get that word off every pill bottle in America. But the variability in these labels was really overwhelming, and it wasn't just in prescription labels. There's been some progress federally through the work of the FDA, and you'll hear a little more from the FDA, to standardize the content on labels. And there was a system in place, but it still could get you lost if you were a patient trying to navigate it. So from a patient standpoint, it was a non-system. It was broken. There was content, different content flying at you from all different directions. Prescribers, that's me. I'm one of those. We had a big role in this. And as we were looking around, we knew that those of us who were doing this, writing prescriptions, and granted today we're not doing as many of those as we were. We're not handwriting them, but there still are a lot of people handwriting them. We were writing this all over the place. So take a look at how we would write Take One tablet daily, how many different ways it could come out within an hour within one health system. We also knew that each one of us could write it differently on one prescription. And what was really interesting was to sit back and think about how that came out on a bottle and what it meant to a patient. Pharmacists, that's where a lot of the action was, another big piece of the puzzle. And you might write, take one tablet, one POQD, I love that, still in Latin, great roots, great remembrances for why it's that way. As a matter of fact, quarantine, I'll tell you, is another great Latin root that meant quaranta, 40 days, back in the days of Boccaccio, who was writing about the plague 750 years ago, and the response of the public at that time to the word quarantine. But the use of Latin, there it is there, still on prescriptions, and you can see that it's written that way, but look how it ends up on a label, and look at what a patient gets to deal with when they see it. And we knew there were some pharmacies out there, some systems that were actually starting to make some changes and trying to figure out, okay, what can we really do better about this? And so some of this was evolving and going on. We were starting to scratch our heads saying, hey, what is a label? Look at all these components. I mean, there's this sticky thing on the container. There's this stuff, the CMI, the consumer medication information, the staple to a bag. Who's looking over that? Is it evidence-based? What do we know about it? What about these package inserts? Who are they really for? Are they really for the patient or are they for the prescriber? Why do they call this if they aren't helping patients? Medication guides, role of the FDA in that. It was complicated. You remember some of this stuff about the labels. I remember Alistair Wood saying a pill bottle looked like a Christmas tree. Precious little real estate with all these little sticky things on it. And when you really got down to it, there wasn't a lot of evidence driving the content that was taking up this very precious real estate. Another piece of the puzzle became the researchers. So the researchers started going to work and started counting some things and trying to figure out, we had from those patient videos, and I remember when those were used, and people said, so you put a face on this. And that's going to be really important for moving this forward. But you need some p-values. And so the researchers were at the table trying to figure out how do we keep the human face on this but get some p-values beside it as well. Well, there were 53 different ways to take one tablet a day written in one health system in an 8-hour period. 53 different ways to write what should be the simplest label signature line on it. And the translations were all over the place. If you had Lipitor 10 milligrams a day, take one tablet every day, it could come out on these labels looking all kinds of different ways. So the enormous variability was actually counted and put into the literature. And there were some bottom lines that came out of there. Labels look pretty simple, but they're not clear. Mistakes are common. The ability to read them doesn't mean that you can actually interpret them or safely and effectively take them, which is what the FDA wants to make sure you're able to do. Mistakes were more common the more medications a patient took. They were more common the lower your health literacy or your literacy level. And the variability in these dosing constructions was felt to be a root cause or a source of some of the confusion. Well, the field of health literacy is moving forward, and one of the biggest lessons in it was that patients are actually the experts. We're not. People who live with this, who figure out how to get through the day, they're the ones who understand this, and somehow we got to figure out how we're really going to partner with them. And I would say that still remains one of the pieces of gold and one of the hardest things that we do as we move the field forward. Well, this framework had come out, we spent a lot of time, first decade, sort of looking at skills and demands, and you heard Dr. Coe say that a paradigm shift really happened when we started looking at aligning the demands and complexities. And boy, we needed to do that. We needed to consolidate medication regimens, which were all over the place. We needed to reprogram that label and see if there was a way to make it more systematic. We needed to reduce the cognitive load. We needed to get rid of some of these unbelievable symbols, like the one down there on the bottom that's supposed to represent pregnancy that no one knew represented pregnancy. We needed to see if we could use electronic records and e-prescribing to move this forward. And pediatric liquid medications were another area extremely ripe for action. Dosing instruments all over the place, concentrations, units of measures, all kinds of them. You remember when H1N1, there was a surge, and here was a health educator whose child had electronically prescribed a label. Give your child 3/4 a teaspoonful twice a day for 5 days. But look at the math you had to be able to do, and look at the dosing instruments that had mass units and not what was on the label. And we saw a public health alert as a response to this and saw that writing had an influence. Focus on quality. That's a big deal. You've already heard about it. You heard Dr. Ho speak eloquently. I'll take us back in time. I remember when John Eisenberg said, show up at AHRQ and talk about the relationship between health literacy and patient safety. And don't talk about whether there is one. There is one. Who understood translational research better than John? And after we talked about it there, and I remember I didn't have a laptop when we went in 1999 to AHRQ to talk about it. He then said, go out and start making some links. And so health literacy and medication labels after that really became framed as an issue of patient safety. And the talks and the data presentations highlighted that. And certainly John saw what was coming forward in the quality field. 1999, To Err is Human had come out. And then we're into the quality chasm, and before you know it, health literacy is linked with self-management as one of the priorities for transforming healthcare quality in our country. And systematic interventions and a systems approach was certainly central to that. JCO, Joint Commission, picking up a report that linked the two. Collaboratives, absolutely huge as a piece of the puzzle. American College of Physicians Foundation pulling together a group, allowing us to look backwards, all the way back into the Natural History Museum at the history of labels, where we were today and how we were going to get out of this if we tried to move forward. U.S. Pharmacopoeia, you're going to hear more about that when Roger Williams stood up and when we began to advance a medication label standard there. This is where I'm probably really in trouble, guys. There are a lot of influencers here. And here's a list of some of them. HHS, sorry, Howard, I left ASH off the list there, but I'm going to add you to the list. You have a big seat at the table. But HHS, legislators, federal and state, the California law with the Latino Coalition for Health, Consumers League, standard-setting bodies, professional societies within medicine, within pharmacy, others, pharmaceutical manufacturers, certainly the media. I like this. Back in 1999, LexisNexis, there were 7 hits in the media, but by 2000, we're up to 128. A lot of them went forward after the work on those labels, which really hit the news and helped to put a face on things. Shout out to the only emblem made for us by a pharmaceutical manufacturer. There'll be some of you who know who that was. They also helped make sure that Senator Breaux showed up at one of the national meetings they convened. Newt Gingrich was at another one. There were national leaders to the table. We even had a chocolate bar with this logo on it at one of the meetings. The AMA, the steering committee that had met late in the 90s, but the people who gathered there who continued to talk about it. Healthy People 2010, 2020. After that, the National Action Plan, all big influences. Surgeon Generals, ASHES as well, who spoke frequently about health literacy, the impact that had, and finally, a gratitude to the IOM. Indeed, you have been a convener, you've been an incubator, you've been a catalyst for it, you've been a home for it. One of my favorite lines from the report, improving quality, reducing costs, and reducing disparities can't proceed without simultaneous improvements in health literacy. That was in the introduction, and I think it was right on target and something we all believed. Here at the IOM, our first of 15 published workshop summaries, and this one I do believe was crafted by our very dear Lila Hernandez, where we were indeed looking at the demands and complexities and how to align them. 2010, another workshop where we focused on the safe use initiative of the FDA in health literacy and how to build better patient-centered outcomes. There's your piece of the puzzle that's still missing. We're not done. It's still there. We've got more work to do. When the report came out, I think we all felt good about the vision it laid out of a society in which people have the skills they need to obtain, interpret, and use health information effectively. within which a wide variety of systems and institutions do take responsibility for providing clear communication and the support to facilitate health-promoting actions. I think that's still the vision that we share. And I think it's once we get that we'll actually finish the pieces of the puzzle. Let me just finally say John Spilsbury was the first guy to have a jigsaw puzzle. He's got some stuff over in the portrait gallery. He used the puzzle as a way to teach about geography, and I think this is another puzzle we can use as we try to teach ourselves about how we use health literacy moving forward. I do think there's an attitude that became the glue for the pieces. I come from Atlanta, and the CEO of Coca-Cola for over 30 years was was Mr. Woodruff, Robert Woodruff, and he in Atlanta, we credit him as saying that it's amazing what you can get done when you don't care who takes the credit. I think that's very true. I'll also tell you that when I looked it up, I found that Harry Truman was credited with it, and before him, Ralph Waldo Emerson. But I think if the truth of it is that it doesn't matter who takes credit, it's amazing what you can get done. So I thank my colleagues and for those that I left out of the puzzle as well. Thanks for your time.